We believe, our forum believes that patient and family partnerships are essential to creating health and economic stability, good economies across the world, because we know that if you don't engage communities and people in understanding what they can do to maintain their health, improve their health, manage their chronic conditions or any health problem they have, there's no hope that we're going to be able to really create health globally. So we think this is a fundamental issue that cuts across all of the other themes of the WISH Symposium, and that it's quite critical to the stability of countries, and it's a critical foundation for all of the work that we're hoping to do here. Our report has been developed by a group of over 20 forum members. People were selected from around the world because of their expertise in patient engagement research. We have many patient advocates that are part of the group, people with expertise in particular conditions, supporting patients with particular conditions. We have patient safety advocates that are part of our group. We have sociologists, ethnographers. We have experts in behavior change. My expertise is around improving the patient's experience of care and how we engage patients and families in helping us redesign the healthcare system. So we have approached this basically looking at what do we know from the literature about the return on investment when you engage patients and families and communities in improving healthcare. We also have looked around the world for case studies that are examples of this. We found many that actually are cross-cutting across all the themes of the WISH Symposium, and we also have engaged a lot of patient groups around the world that think about this topic. We hope the impact of our forum will be that the health ministers and the economic ministers and other national leaders that are attending, health system leaders, will adopt our recommendations. We're prioritizing our recommendations based on feedback from our forum members as well as all the other participants in the symposium, so that people can take these home and put them into place. We're hoping that they will focus on things that improve the social determinants of health in communities, as well as involving patients and families in the redesign of care. We know that when you get input from the people you're serving, it helps provide better care. We know that although sometimes this is something that's a little bit frightening to healthcare professionals because they're not used to these partnerships, that once they begin to do it, they can't imagine how they ever did anything differently before. And once you get patients and families involved as part of the care team, we actually get the care delivery system designed correctly, and we get it right. And it improves the quality of work life and satisfaction for healthcare professionals because everyone comes into healthcare to improve the healthcare of the people they're serving. And when we understand what people's needs are and how we can partner with them to educate them and engage them in maintaining their health, that's what it's all about. And so we're hoping we hope that our recommendations will help people understand what we need to do, both on the side of how do we raise the level of involvement for patients and families, as well as how do we give our healthcare professionals and health systems and people that lead community health the skills they need to do these partnerships effectively. When I was invited to be the chair, my initial reaction was, I don't need any more trips, I don't need any more extra work, although I'm very passionate about this topic. And when I really understood the purpose of the WISH Symposium, I signed up immediately because the opportunity to work with an international group of experts in this area to come up with recommendations that are specifically designed to be implemented and acted upon, that's a dream come true. And I think the global nature of the participants and the type of people that will be attending the WISH Symposium is something that attracted me, and I know that it attracted all of the other members of my forum.